Well, if you're training for a future marathon or getting ready for this weekend's Rock and Roll Marathon, here are a couple tips you can use. Team 12's Brian West talked with the physical therapist on 5 things you can do before, during, and after a race.
Keith Garrison is a senior manager for Banner University Medicine Rehabilitation Institute. He deals mostly with sports training patients as well as those in rehab and recovery.
You really should be training for a marathon probably 3 to 6 months prior.
He has 5 tips for runners pre and post marathon. During training, tip number 1. It may seem obvious, but it's always overlooked. Stretch.
Pre-race, do a dynamic stretch where you're doing a lot of movement while you stretch in order to get the muscles ready for the run.
Number 2, if you have an injury, carefully rehab. One way his center helps patients is using an anti-gravity treadmill.
It's going to fill with air and compressurize, and as it does that, it actually lifts you up off the treadmill, so we can set it to a percentage of weight bearing. So let's say that when you run, you have knee pain because of an injury that you have there. We decrease your weight bearing to maybe 90% or 80% of your body weight.
Number 3, roll out the pain.
Doing some of the myofascial release, so that's kind of what the rolling is about.
4 is post-marathon, and again, stretch constantly.
You want to do a static where you're standing still and doing stretching, and you need to do that several times after the race throughout the day, as well as the following days.
5, know the difference between using hot and cold treatment.
The heat is going to bring a higher blood flow to the area, and it's going to bring in new healthy cells, but it also brings inflammation. So if you have an injury, you want to use ice to decrease the inflammation.
Happy running. Brian West, 12 News.
If you're running the marathon tomorrow, you will likely be sore regardless of your running level. Keith says if you are sore in a specific area after 5 to 7 days, be sure to consult a medical physician.